breaking barriers and bridging the gaps between patients and doctors. Welcome to Brainstorming with the Docs and your co-hosts, Dr. Glenn Harrison and Dr. Kolby Condos.
All right, everyone, welcome back to this week's episode of Brainstorming with the Docs. I'm Dr. Kolby Condos, my co-host, Dr. Glenn Harrison.
How are you?
How's it going? Yeah,
I'm
good.
doing good. This topic is it can be humorous, but it can also be tragic.
Yeah, and uncomfortable, right?
Yeah, for sure.
So today we are talking about libido. Why did we choose to talk about libido? Because it's something we get asked about all the time. And I think that in a lot of cases, it is a unintended or uncorrelated side effect to a lot of other things that maybe you have going on. So we're going to break down maybe some things that you should consider if you have low libido. If this is your first time watching or listening, please hit like and subscribe, turn on notifications, because we're going to continue to roll out new content each and every week. And hopefully one of these episodes is applicable to you. So without further ado, let's talk about libido.
Libido. Well, I think, like I was just talking, to you earlier, that, there was three new inquiries today. And top of the hierarchy was the concerns of libido, men and women. So this does affect men and women. The thing is women will be willing to ask about it. Men, not so much. It's not spoken of till it's really, really a problem. So it does affect men and women. Like I said, it's tragic, but what is it? It's low sex drive. That it results, see it all too often, loss of intimacy between partners, and then the relationship can fall apart. Creates insecurities on both parties. And then when that happens, it turns into emotional health challenges, again, insecurities and confidence and all of that, and then ultimately leads to isolation if it's not properly managed. And it's more than just a little blue pill to fix these things, much more. So what are some of the causes of lack of libido?
So we're going to touch on some big ones. This is not a comprehensive list, this is not a comprehensive list, because that could be really, really long, right? But what we're talking about as far as things that I consider if I have people with low libido or poor sexual function and stuff like that is, you have to look at blood flow, right? The reproductive organs are an organ and they require blood. So do you have things like small vessel disease? Do you have cardiovascular disease, like heart disease? Is there any issues there? Number one. Number two is their blood sugar issues, right? If you want to have dysfunction within, as far as sex drive, anything that requires a lot of blood flow, you throw on like blood sugar issues or diabetes, and watch out, because here it goes. It's not going to work anymore. Then we can look at, is it a lack of certain sex hormones? And you can investigate that via a blood panel.
Exactly. And just to touch on that, everybody, a lot of times when you think of people are pursuing libido efforts, everybody runs to testosterone. It's like, okay, right. This is the erection medication. And it isn't. It's not that simple. So sorry, I was interrupting.
No, that's all good. Well, I think that especially with that, when you look at, is it a lack of testosterone? Then you have to go, well, why? Why do we lack testosterone? Right. Are we converting it to something else? Are we not making enough? Do we not have the raw materials to produce testosterone?
Are we resistant to it?
Are we Yeah, exactly. So there's a bunch of underlying things there. So a lot of people go, oh, I have low libido, or I have ED or whatever. And they're like, oh, but I take, whatever it is, TR.
Yeah. We're in a culture, we just take more. Take more. Hormones are especially like this. I never hear of anybody being diagnosed with too much hormone.
Yeah.
And sometimes when we've talked about this, and sometimes that's the case, but it's always a lack of. So we just got to take more and more and more.
You just got to go on this TRT.
Yeah, there's always a deficiency model. Everybody needs more. It's like supersizing, but now we're supersizing, testosterone. Whatever.
Right. It could also be like progesterone, especially in females, right?
That's right.
It could be something as simple as like confidence or, insecurities or mental health stuff. One thing that I kind of consider, especially from my background, is it like an autonomic finding? So autonomics, basically, I kind of summarize it as the way that your body decides where it should push blood. So is there an issue with, regulating your autonomics so you're not pushing blood to where it needs to go? Right. Is it an issue with circulation? Do you have lack of physical, endurance? Are you not active enough? Are you reliant on something else as far as like a medication, or are you experimenting with other types of like recreational drugs that can mess with it? So there's a ton, and that's, like I said, that is not a comprehensive list. That is just a list of the ones that were off the top of our head type of deal.
And also emotional health disorders that play really confidence. So as you said, the sympathetics, the parasympathetics, we talked about this, but the autonomics, if there's a stress response, the body does not invest, the brain, the nervous system does not funnel blood to
areas that it does not perceive as being very important for basic
survival,
function and survival. Yes.
Yeah. So it pulls blood away from the GI tract, from reproductive health, reproductive organs. And if that blood isn't there, nothing happens. Those tissues do not work. Those tissues do not get aroused. It just doesn't happen. And all it takes is insecurity, depression, anxiety, fear, stress, any of that, sleep deprivation. So, when and I don't have any children, I just have that furry dog that hangs behind me for a while. But with couples, right? New couples, and suddenly they have one or two children, new children. Life gets busy. Their careers are on. All of this stuff happens. Well, they are in a stress state, and libido is one of the first things to fall in one party or the other party, and then they go through challenges.
Right. I think that it's important to note that your body does not perceive stress as different forms of stress. Right? Your body doesn't know the difference between my 8-month-old is crying and I'm being chased by a grizzly bear. Right? Your body responds like physiologic. Yeah. It's just a littler grizzly bear. You know what I mean? But I mean, your body responds on a physiologic level really similarly. So stress is just stress to that. So if you can do some things to mitigate that and control your stress, then definitely going to be beneficial in the long run, especially in regards to your reproductive health and your libido, right?
That's right. And we never talked about this, but when libido goes down, libido is reduced. Sometimes it can even mean, you talked about cardiovascular, so I just want to touch on that. Sometimes in men, mostly, there's got to be some research in women, but if there is ED problems in men, it can be kind of like an indicator of cardiovascular problems, like something else that is for survival.
Yeah, one of the more prominent ED pills that is out there was actually formulated originally as a heart medication.
That's right.
And I can't tell you which one, but you guys could find it if you looked on Google, I'm sure.
Yeah. So cardiovascular health can be a problem. So there can be bigger underlying things, not just arousal difficulties or whatever. So some strategies for it. So I know our world, we're always talking about labs and what to figure out. I think running, hormonal panels are very, very important. Understanding if there's a blood sugar issue. So make sure there's no prediabetes, hypoglycemia, or diabetes that is high on the table. And then look and understand, proper tests that are going to determine heart health. So if there's an erectile difficulty and it's been going on, and somebody has a lot of cardiovascular risk factors in their family, just family history, just going and buying those magic little pills, that is, could be dangerous. Dangerous. And you could be missing a warning light or something bigger that's going on. And then you don't know until you have a heart attack.
Right. So that's doing stuff like heart markers. You could do a calcium score test, all that kind of stuff. We've talked about that in the past as well.
Yeah, I believe we did. Yeah, we did a podcast on cardiovascular health. So those are, some blood labs, but then lifestyle is where the magic happens. And it's not sexy and glamorous, but I'll tell you, it works. It is the original medicine. It is the original medicine, the real medicine. Exercise. So we've talked about, training, different types of physical activity. I don't even remember the name of that podcast.
Yeah, we did one on the most clinically effective form of physical activity or exercise or something like that.
That's exactly
good resource if you're curious on that.
Yeah. The dietary pieces. Now there's so many components of dietary. And, I just had an inquiry today. So, this lady had all these symptoms. She didn't mention libido, but, she's like, what is the best diet for me? I'm like, oh, I didn't even know her history. It was kind of an initial consult. I'm like, well, there's, I guess if I don't know anything about you, I'm going to say eat real food and cook your own food. Mm-hmm. Well, that's kind of a boring answer, right?
Yeah. Raw fruits and veggies.
Yeah. So what
organic meats.
What is the right diet for you? Well,
let's tailor it to your physiology.
Yeah. And you don't want, processed food. You don't want, you want real food. You want to cook it. You want to do the perimeter of the grocery store, etc. So there's a dietary component. It is just standard. Stress management. We've talked about, we've had Erica Hubbard on a podcast, and she talked about anxiety and some tools with that. So there is a component, a very, very big component to emotional health, therapies and counseling and all of that. And as a couple, I think it's very, very important. If this is a couple's activity, that should be couples conversations about these things.
Yes, definitely.
People have a lot of courage to be able to talk about these things open. But if they don't have the courage on the front end to talk about them, and they wait till things are broken, well, then there's nothing to talk about because the relationship is done.
Right. I think that if you really wanted to increase your libido and you did all these things, you're eating well, you're providing your machine, your body with the appropriate fuels, you're exercising, you're losing some weight, you're feeling confident in yourself. And then all of a sudden you hop out of the shower and your spouse is there and they go, oh, like,
what is that?
Like, oh, like you're looking good. You're taking care of yourself. I'm going to do the same thing,
True.
And so when you look at it, exercise is a really effective way at helping you manage some of your stress. That's been shown time and time again. So if you're doing all these things and you're willing to really do them, then you can almost take it to the bank that it's at least going to improve. Now, will it go away all the way? I mean, probably not. Right. But even if it gets 80% better,
what did you lose?
What did you just gain? Yeah.
Yeah, exactly. So there's a lot of pieces to it. There's some strategies when you get into nutrition. I know we talked a little bit about that, controlling blood sugar. There's all sorts of, herbs and nutrients and things like that, dietary pieces. We've talked about in the diabetic podcast. So if there's any concern of blood sugar dysregulation or diagnosis of prediabetes or diabetes, and there is a libido issue, get all over that podcast and jump into that. That was 2 parts, I believe, right?
Yeah. Yep. I think so.
Yeah. And then another thing is DHEA. We've talked about it. We both use it in the clinics. I know I do. I'm assuming you do a little bit as well. But DHEA is a hormone that women particularly need because DHEA is required for testosterone in women. So men have testes and adrenal glands. They both make testosterone. Women only have adrenal glands to make testosterone. And so they need to be able to make, the adrenal glands will make their DHEA, and DHEA will help convert and produce testosterone. So, so again, nutrients, DHEA can be very helpful over a period of time with the lifestyle factors with women to get their testosterone up, if that is the cause of
right. Don't just think that taking this is going to solve all your problems, because you got to figure out everything else too.
Exactly. And then there's all sorts of fancy herbals and cocktails that historically that were used around the world for libido. I don't know, the research isn't that solid on it. Maybe it's just there's not enough investment in that.
Sure, it could be some anecdotal stuff too.
Yeah, for sure. But it doesn't matter. Remember, I think the biggest thing for anybody listening to this, remember these organ systems require blood flow. If anything shuns the blood to another area of the body, any emotional distress, anything at all, it doesn't work. It doesn't matter the level of emotional arousal. None of that matters. And it doesn't matter how many capsules of whatever you take, won't matter if the brain says, nah, blood's not going there. We're not reproducing. Blood is going to your heart because we have to run away from,
going to your large diameter muscles.
Little grizzly.
That little 8-month-old grizzly that's crying in the crib.
Yeah. So I know we talked about a little bit of DHEA. What are some other supplements that you've used or that you see?
Well, I think that one thing that we use in our office is if we have issues like this, is we look at what, we do a lot of hormone panels, and then you can look at, if there's too much of like things like estrogen or you're aromatizing testosterone, what do you need to do to get that back up, and how do you get rid of all the stuff that's maybe not supposed to be there. So you can use some supplements that'll help you balance your estrogen levels. I mean, there's things like, DIM. There's things like estradiols and stuff like that that'll help as well.
That's right.
Or you could get stuff like, you can get that from broccoli too. So maybe just eat some broccoli.
Yeah. So trying to get this estrogen out of the place, out of the body, if it is inhibiting.
If it's too much. Yeah.
And that's back where the labs come from, to have an understanding. Labs don't create libido. Labs will hopefully give a little bit of direction of which way to go with it. But everybody is, so many people pursuing libido function, and they're like, what do I take? Well, what do we fit? What do we correct? What do we balance? What do we restructure? And like you said, Dr. Kolby, if people are covering so many of those lifestyle pieces, it's going to have a profound impact on everything. So I guess that's, I don't know. I don't have anything more to talk about.
No, I think that's it. You want to increase your libido. I feel like these are some really solid starting points. And if you address, there's a lot of these things that you can address on your own at home. Right. It doesn't have to be perfect. You just have to start. Right. So I hope that this gave everyone a good springboard and a good launching point. If you have questions, you can get a hold of us. Our email associated with the podcast is info@brainstormingwiththedocs.com. You can find a lot of information on our websites. Mine is northlakeschiropractic.com. Dr. Glenn's is drgharrison.com. Or stay tuned, because we're going to continue to roll out each new content each and every week, and hopefully we roll out something that's applicable to you. So
well, that sounds
until next time.
Until next time, I hope you don't get too much sleep tonight.
All right, buddy.
Bye-bye.
Bye.